Hey, this is Dr. Cory Glenn. I'm going to be showing a technique that I use to restore wraparound caries. Now, we all know this is a really challenging scenario. Patients got decay that goes from the facial all the way through the interproximals and back to the linguals. And previously, I didn't really know a good way to restore these other than to, do one side and then come back, prep into that a little bit, restore the other side. But something that I've discovered that works really, really well for these is to use a greater curve band. You might have also heard these called banana bands. The shape that they have is going to allow us to really get access in to be able to put this on and then just pack composite in almost as if you would an amalgam preparation. So right now all I'm doing is I'm going ahead and taking out the decay. I do use Caries dye on these, so I generally try to get as much as I can see out of there, and then I'll apply the Caries dye and have the assistant rinse that away. And any areas that are still staining pink will tell us that that is either caries or affected dentin. In the case of that mesial of the lateral incisor, that's probably just affected dentin, but I'm just removing that to make sure. In the canine, that is most definitely caries. So going ahead and removing that. And I'm taking great care here to avoid touching the gingiva, because no matter how you're restoring these, once you hit the gingiva, all bets are off. You're going to have bleeding. And so you'll see here I'm actually using a flat-ended instrument to get the very last of that little ring of enamel where the decalcification had eaten into the enamel. So this protects the gingiva, keeps me from gouging it and starting bleeding. And once we do that, this is the greater curve band going on. And so you'll notice that I'm applying it from the lingual, and the reason I do that is because obviously that's going to give me greater access from the facial. But another thing I'll do is I'll go ahead and prep away a good portion of that band so that I've got even better access still. And so the greater curve bands, you notice that shape that the banana shape gives to it. Once it's folded in half, it really flares the proximals out and gives you great seal at the gingival margin, because it just sucks down around the neck of the tooth, and then it goes wider as you get more coronal. And so this is going to give great isolation. Many might choose to rubber dam this case. I feel like, being this far subgingival is going to be difficult with a rubber dam, and really with the isolation this gives me and my assistant being able to stay between my retainer and the tongue with her suction. We have great moisture control. And notice right there how clean the margin is, the great access that we've got, and it's going to be very simple to restore this. So I'm using another one of my favorite products here. This is called Clean and Boost. It's from Apex Dental Products. And so the other thing is we've got to remove plaque, we've got to remove organic debris. We all get handpiece oil on our preps, and how do we get that off? An aqua cut sandblast type instrument would be great for that, but I find this to be a cheap and easy and convenient way to do it. And the Clean and Boost is just a solution with a scrubby tip. You can scrub it on, it'll remove organic debris. We can remove plaque with it, and it also has an etching action with it. And so here I'm using Scotch Bond Universal, and the use of the Clean and Boost beforehand gives a little bit of an etching action prior to going in with that. So now I'm going to be doing what's called the snow plow technique. And so down there at that apical portion, it's difficult to get composite packed all the way in there. So I'm applying just a very small amount of flowable composite in that area. And now I'm going to take my regular composite and snow plow it into it. And so the idea is I'm going to just inject right into that. And as I do, the thicker viscosity of that is going to push that down right against the neck of the tooth, where we're going to have an infinity margin. And so I've put enough in there that I think I can shape that and get most of my contours filled. And so here I'm pushing all of that into all the different areas that need to be restored. I don't take a whole lot of care in getting a perfect shape with these, because inherently doing this technique you're going to have to do some cutback with your handpiece. So I'm not focusing on trying to get perfect anatomy. Following up with a little bit more final layer right here, and then I'll cure that. So that's it for that one. That one was a little bit easier simply because it was only a mesial facial. Now the lateral here, we go all the way to both proximals and to the lingual, as well as the lingual pit on this tooth. And so thankfully that band was able to just be replaced. If it hadn't been, I'd have just done a new one and put it on there. But now the cleaning boost is going back on, cleaning that tooth really good, scrubbing every surface, making sure I remove any plaque, and also giving a little etching action and removing the handpiece oil. And then my assistant will rinse that off and briefly dry it. I want to get rid of any pooled water, but don't desiccate it. And now the Scotch Bond Universal adhesive going on. And again, I just love the isolation that these bands give me. You can see that it's just it's well below the subgingival area, and nonetheless, I'm having no issues with bleeding whatsoever. I've got great access to all the margins, and so we've thinned out the adhesive, evaporated the solvent, and now I'm going to restore. I'm doing the little lingual pit first with some flowable, curing that. And then in that proximal area, I'm also going to come and similar to how we would do a palatal shelf, I'm just doing a little injection in the area where it protrudes through into the lingual and curing that. And that's going to give me something to pack composite in against on the facial so that I don't have everything extruding out the back. So I've closed my holes there. Again, snow plow technique. I'm going in with my composite, snow plowing it in. That's reducing any potential voids. It's going to give us that infinity margin, which you're going to see here in a bit. And you can see some of that gets extruded out, that flowable, and displaced by the conventional composite. This is Filtex Supreme Ultra that I'm using here. And so I'm curing that, removing it. Now, unfortunately, my camera died and I did not get to show the initial trimming, but you have that lip of composite that you will have to go back and trim. And to do that, you have to have a very sharp needle diamond like what I'm showing right here. This is an extra fine needle diamond, and this works very well for going in just in between the gingiva and that composite and bringing in the shape. And so I've already done the gingival bulk reduction, and now I'm just going back. I've done most of that with water. Now I'm doing it dry and seeing, any final contours that I need to cut in, smooth up, all of that kind of thing. But you can see that the contours that we've generated are really nice. I am having to go back and reshape the lingual just a bit. And so using a round-ended diamond, these are the two burrs that I pretty much use exclusively in my composites. This one for doing facial and lingual areas, flat surfaces, and then that round football fine diamond for doing occlusal surfaces and lingual surfaces. So these are Cosmodent Top Finisher cups. These are the best polishers that I've found. They work really, really well. I do the blue first, get the initial polish, and then I'll follow that up with the pink cup. And these get a great shine on composites, and they're very easy to use, very affordable to use as well. And so now what I'm trying to show is, one, the smoothness that we've achieved, and two, the infinity margins, as I keep calling them. The way we did that snowplow technique and the way we applied that greater curve band just gives us an undetectable margin. And I've been doing this for years now, so I get to see these on recall. They look great on recall. I just have not found a better way to do interior composites where I can get that nice glassy smooth finish and transition down to the actual tooth, especially in subgingival areas. So I hope you found that helpful. These bands have really made my life easier in restoring these difficult cases where access is just hard to keep everything isolated and hard to contain the filling material where I need to fill it. And so hopefully you'll find it useful. Thanks.